The risk of suicide among young people is always a concern, but now even more so during the pandemic. I'm joined by Gabrielle Sear, who is the Suicide Prevention Coordinator at CHR, and Joe Navarra from the Office of Disability Services at Manchester Community College. Welcome to you both.
Thank you for having us.
You know, let me start with whoever wants to answer this question, but we're seeing numbers as high as 90% of the cause of death for young people would be suicide. But is it getting worse with this time?
Well, the trend has been going on for a long time, that it's been going up since the 90s. Suicide is the second leading cause of death for young people between ages 15 to 24. And certainly now with the virus, the number has been going up. People are very stressed, they're overwhelmed, and certainly the risk is higher now.
Yeah, and I guess this has been a troubling trend, 33% increase since 1999, but perhaps we won't know till this is over how much more this time played a role. Gabrielle, I know you're in charge of trying to help prevent this trend. What do you want people to know who might be facing trouble right now?
It would be good for them to know that CHR is there for everyone right now. You could call our assessment center or 211 to get services and know that there are people out there ready to help you, ready to talk, and give you whatever you need.
Why is it that young people struggle with suicide so much more?
I think it's a really pivotal time in life. I'm around the age that we're talking about here, and there's a lot of decision making and a lot of transitions, and those can be really hard to navigate if you don't have strong support in making those big decisions. And so this is also a time where there's a lot of onset for different mental health disorders or depression. And so I just think it's a really troubling time for people.
And Joe, we know that isolation, social isolation and depression increase the risk of suicide. So certainly we're seeing a lot of that just in the collective right now. What do you want for the people you're serving to know?
Well, certainly for the people who are connected to a college or university, that, most colleges and universities have resources available, whether it's video, whether it's phone calls, or whether it's chat. There's help available at colleges and universities. If people are feeling overwhelmed, there's also the line that Belle mentioned. There's also the National Suicide Line. That's 1-800-273-TALK. Suicide lines have been very effective in keeping people safe.
Yeah, and just right now, I'd like to bring up the Hero Hotline that CHR has. I believe we have a graphic of it, and here it is. CHR's Hero Hotline can help you if you're experiencing extreme stress due to the pandemic. The number is 1-888-217-HERO. And this is a great resource for anyone who might be just struggling a little bit. There's help on the other end of this phone line, right?
Yeah, so there's CHR clinicians and therapists who are trained specifically in stress to help approach what different people are having right now through this pandemic.
Well, Gabrielle and Joe, we want to thank you for giving us this resource and helping us get the message out to the public that they don't have to suffer alone. But as we go a little bit deeper in this time is so difficult for so many, and we're talking about reopening now. Do you think that's going to be helpful, or the people who are already struggling, it's not going to matter that things are starting to reopen?
Well, I think that as we're returning to a sense of normalcy, I think people are having some hope that they'll be able to, reconnect with people, friends, and family. The key is how we do that in a safe way. So I think as the restrictions are sort of easing, I think that it's filling people with hope. The weather is getting better, so I think people can get outside and see friends and family safely as we can, gather outside.
And Joe, I want us to keep it with you for a second.
The risk is more. I'm sorry.
Oh, I was just sorry to interrupt there. I wanted to keep it with you for a second before I move on with Gabrielle, but you brought up getting together safely. We just saw over the weekend with a lot of young people congregating in large groups, not social distancing. The college kids seem to, sometimes it's a little bit more difficult to get them to understand the importance of this, or even the fact that that is the governor's order. What are you saying to the students out there?
everyone that I'm talking to, when I tell them to connect with people, I tell them to make sure they do it safely. The latest data and research shows that, we can gather safely if we keep our distance or wear a mask. And that's what I tell all the students that I'm speaking to.
Right. So it's a good message that people can start to maybe interact a little bit more. And so long as they're doing the 6 feet away and the masks, or at the beaches, we know we've been trying to get the word out that it's 5 people at a time. But 5 people at a time is better than probably what people have been dealing with, where they've been all alone. Gabrielle, that isolation certainly, I would think, has been a problem for the people that you're trying to help.
Yeah, and so we're doing our best with providing services via telehealth, but for some people, not everyone is safe at home. And so it's just important that people get back out to the people who support them and who can take care of them, and, friends and family, and break that social isolation. But like you and Joe are mentioning, doing that in a safe way, not to make matters worse for ourselves.
I was startled to read the statistic that in the U.S., someone attempts suicide every 31 seconds, and 113 Americans die from suicide every day. That seems very high.
Yeah, the statistics around suicide are very startling. Go ahead, Joe.
Sorry, Val. Yeah, the numbers recently have been going up, and certainly the virus has kind of impacted that in the wrong direction. I think it tells us all that we need to be responsible for each other. The idea, CHR, the zero suicide model, where anyone can check in with someone about their mental health, and so in Manchester, we really tried to create a community that could respond to someone who might be in crisis and might be thinking of ending their life. And I'm hoping that we can use this opportunity to get the word out so that we're all watching friends and family members who may be at risk.
Yeah, and we know that those who are most affected often have already suffered from PTSD and substance use disorders. Gabrielle, have people even just in general been a little bit more afraid to go to their appointments or to get help because of the pandemic? And do you want them to know that, in fact, there are safe measures? If nothing else, by telehealth, you can really still help a lot of people.
Yeah, so people through CHR can definitely make telehealth appointments and still do this remotely. But as the world starts opening up a little bit more, we're hoping that people do continue coming to their appointments and getting the help that they need. And so people can always call 211, or they could call the assessment center and check in about what services are available to them that are safe and remote, and even within the building, masks and taking temperatures and hand sanitizers everywhere. So they're definitely taking the precautions that they need to make sure that everyone's able to get what they need without having to be afraid of COVID.
Yeah, and Joe, what are you hearing from the young people on college campuses like where you are? What would you say the general mood is about reopening?
I think folks are hopeful. But I think this happened in the middle of a semester, so many of them just tried to figure it out. So many of them were also essential employees. So I heard a lot of stress from students because they were having to work more. The faculty and staff stayed home, but our students often were going to work, and they were going to work more than they actually planned for, and then they had to deal with classes that newly went online. And it was a very stressful time for, so whenever I talked to one of my students who was overwhelmed, I said, I appreciate you getting out there, 12 hours, because you're helping to keep the food supply going, or keeping the economy going. Because so many of my students were really called to work more, and on top of having to deal with online classes, it was incredibly stressful for them. So now that the semester just ended a couple of weeks ago, there's a sense of relief that I'm getting from the students that I've been talking to.
That's good to know. And I know it's been stressful for so many people. All of us have had to learn things quickly, go through changes, which can be stressful in itself. Gabrielle, CHR has this hero hotline. We can put it up on the screen again. This was originally, the idea would be that all these people who are essential workers would get help by calling 888-217-HERO. That is still the case. But you also really today want young people or people who love the young people in their life, if they see them struggling, to call this number. Are there certain signs that we should really be aware of? I think most people who've been victims of suicide and their family will say, I wish I would have known, or I wish I would have done this. What should people look out for?
Yeah, so any change in behavior, any type of direct statements, it's really okay. And I want to reiterate for people that it's really okay to just ask your youth or anyone just directly and being directly, straight up about your talk. And so being able to just ask someone, are you feeling depressed? Are you feeling suicidal? Is there something I can do for you? Is really important if you see any sense of change in someone, if they don't want to do things that they usually love to do, if they're not as chatty as normal, anything like that. It's just important to check in, especially during this time, daily, especially with the people in your home and in your immediate life.
Absolutely. And on this phone number, people will be able to get immediate coaching and guidance. There's also the state number, we should say, the 211 if you're in crisis. I know you want people to know about that crisis text line, that they can also use 211 or the crisis text line, which is you text 741741. But really, this special number that's easy to remember, 1-888-217-HERO, is available to anyone. And even if you haven't had help with your mental health before, making this phone call could just, if nothing else, provide you peace of mind that what you're feeling is normal.
Absolutely. It's just another person also experiencing this, on the other end to talk through whatever it is you need. And you might not need a follow-up appointment. And so that's okay, but you could get it off your chest and have someone who is trained to talk about these things with you.
Absolutely. Thank you, Gabrielle. And sometimes, family's not the right spot, especially, Joe, you deal with so many young people, and maybe they have parents in their life, but they might be more comfortable talking to someone who is trained to deal with this, who might be a little bit more comforting than even the family they're living with.
Yeah, the family members are going through this too, so they might be more stressed. And so, we work hard to make sure we're taking care of ourselves so that we can be there for other people. So I think the students I've been connecting with have appreciated me reaching out to them.
Well, I'm a big fan of getting help when you need it, and I know so many people can really have a change when they have the right people who are skilled, like both of you, guiding them. So we just want all of our viewers who are watching right now to know about that phone number and know that it's available. And thank you at CHR and you, Joe, for all that you're doing. The number again is 1-888-217-HERO. It is the HERO hotline. It's absolutely free. You can call right now or give the number to someone who might need it. And we hope we can make everyone feel just a little bit better during this stressful time. Thank you both for being here.
Thank you.
Thank you so much.